Good morning, and thank you very much for the opportunity to join you at the start of your very important meeting on how we promote physical activity to improve the health and well-being of everyone in Italy and, of course, globally. My name is Fiona Bull. I'm head of the Physical Activity Unit at WHO headquarters in Geneva. I am very sorry I'm not here to join you in person at your meeting. I would have loved to have been able to do so, but I am pleased to be able to provide a few introductory remarks and set the scene at a global level for where we are, what we're doing, and how we're progressing on promoting physical activity for good health. So if you'll allow me, I will just share my screen and present some of the slides where we are able to see the agenda of our work and look at the important opportunities we have going forward. And I see I'm at the end of my slides, so I need to very quickly move to the beginning of my slides. Thank you for just bearing with me. And here we are. It's a really important time for promoting physical activity locally, nationally, and globally. And on the right-hand side, Dr. Tedros, Director General of WHO, sees the importance of physical activity and sees how it can contribute to our 3 billion target shown in the middle, and where physical activity will help improve 1 billion people's health and well-being, and how that is important to promoting and achieving the Sustainable Development Goals, and not least the SDG 3, good health and well-being. I'm sure all of you are aware in this audience of the importance of prevention and management of non-communicable disease, the leading cause of death, leading cause of premature death. 74%, 3/4 of all deaths are due to non-communicable disease like chronic disease, heart disease, stroke, diabetes, cancers. 17 million of these deaths are before the age of 70, and we regard them as clearly preventable premature deaths. I've mentioned the SDGs and how it fits with, of course, our goals for 2030, the importance of health and well-being to all SDGs. But physical activity has a particular role in how it can contribute to many of these SDGs. Let's not forget, through sport, we can address educational outcomes, helping children achieve their potential, gender equality, through sport, strengthening the role of women and contribution to sport and society. And here shown healthy cities, because if we design cities, local communities, so there's more walking, cycling, access to public open space, we can create the sustainable communities we want, as well as health and well-being. Now let's look at the global response. If that's the biggest of pictures in terms of where globally we're going, locally we want to achieve, then how does physical activity fit? Very briefly, I'd like to introduce 3 documents that really anchor the work of WHO. And on the left, you're seeing the global guidelines, the evidence on how important physical activity is for health. In the middle, you're seeing the global action plan. I want to extend my thanks to those collaborators in Italy that have translated this document, so you have access in Italian to the guidance and direction that we propose and suggest for countries and communities to follow. And on the right, you're seeing one of the reports that shows how well or not we're doing in 2020 to promote physical activity. So looking at the first document, we can see that the slide here shows every move counts. That is the benefits of physical activity increasing by how much more you do for all ages, men and women, and all abilities. We're encouraging people to move every day for health benefits. The specifics of those guidelines are summarized here in the infographic that's available for use, showing you for different ages, different amounts, different types, but most importantly, every move counts. The new addition in 2020 was the highlighting of the importance to limit sedentary time, the far left there in red. And that is an emerging science, which I think we'll all be paying attention to in the coming years. So if we know it's important, what are we doing to promote physical activity? Well, WHO has produced a global action plan in request by countries to provide that guidance. And in 2018, we launched this global plan along with a global target. 10% reduction in physical inactivity by 2025, 15% reduction by 2030. And we really note there are many ways to be active: sport, cycling, physical activity, dance, play. All of these are ways to be physically active. The action plan is built off 4 pillars, color-coded and shown here, and embedded are the specific actions that can be implemented at country level and most importantly at the community level. So all of you here today for this conference, thinking about what do we do, where do I fit in, you are very much part of one or more of these areas, contributing to promoting the social norms, the knowledge and awareness of the importance of physical activity, shown in red, number 1, designing and implementing the community spaces, parks, playgrounds, walking, cycling networks. These are what we need to be physically active. And then there's the programs, whether it's in workplaces, schools, healthcare settings, and the community settings, reaching out to all of the community, young and old. The programs are important to help people be active. And that's number 3. And then lastly, number 4, how we make that all happen. I'll come back to number 4 because it's really where many of us fit in helping all of the other 3 areas work. When we look at the global action, we can see the 4 pillars and we can see the recommendations of the global action plan, color-coded, but interlinked. The lines provide those links, showing us that how we do one thing can affect another. And we call this a systems-based approach. Collective action at local level and other, strong partnerships, coherent evidence-based policies with good evaluation, so we can make the impact we want. What does it look like? Well, here shown are some of the ways we can promote through communication campaigns, whether it's in India, New Zealand, Brazil, Australia, and Italy, the ways we promote through mass media communications about the benefits for different ages, different genders, and different health benefits. Events to engage people, young and old, enjoying ways with their families and friends to benefit at that time and hopefully then be inspired to continue. The environments we want to create for walking and cycling in particular, addressing climate change, addressing air pollution, addressing congestion. These are local issues you'll be talking about today, and physical activity is the viable, practical, affordable options for sustainable mobility. And then there's the programs I mentioned about getting young and old in community settings which matter and are close and affordable and accessible. And you can see the smiles and enjoyment here of different ages and abilities. These matter, and we need to invest in the communities that provide these, the non-government providers, as well as government, and indeed partnering with private sector. And lastly, it's about making that happen. The governance, the data to inform, to track progress, to evaluate, partnering and working with researchers and scientists so we evaluate and innovate. And of course, making sure that our words are supported in policy and in investment. And you're going to be talking about all of these today. And that's important because the most recent data from WHO assessing global levels of physical activity show that unfortunately we have now risen to 1 in 3 adults not meeting the physical activity recommendations. We already knew that the problem was very large in our adolescent populations, where 4 out of 5 adolescents are not meeting the recommendations. Looking at those data recently launched back in July of this year, you can see the global data at the top and then regional differences. There are some regions that are more inactive than others, as shown as you look across these regions. But you can also see, by looking at the blue and the gold, the differences between men and women. And the gold is larger in most regions than the blue. Women are less likely to be active. That gender inequality exists and persists across the world and over time. We look here at age, and you can see in the 3 categories of age, in the dark green, the over 60s age group, how big a difference. Older adults are less active. And I think in Italy, with an aging population and the demographic trends across Europe and around the world, this is a very important issue. Older adults benefit from physical activity, health and mental health, physical health, social health. And so we need to address promoting and providing opportunities for older adults. And lastly, a profound message from our recent guidelines and document is that the world is off track. We are off track to reach the global target in 2030. And here you can see the data, now shown with the dark red. And the dark red is showing you that the levels of physical inactivity in 2030 will reach 35% by 2030. And in almost all regions, you can see that we have an increase. These are worrying trends that we need to address at all levels. Now, if you're interested in finding more about these studies, then you have the Global Lancet report on the right and our own WHO document on the left, providing you the headline results with some summaries. And our recommendations now on the basis of these data, and of course, promoting the Global Action Plan, are that there are 6 actions we encourage countries at all levels to look at. And I hope your meeting today will be exploring how we can strengthen the prioritization of physical activity. We can focus on women and older adults for our interventions and our investment. We can look at resources and make sure they align with our policy programs. But to do all of this, we must intervene and promote a stronger workforce. So that means training programs, collaborations between sport and health, and making sure we're promoting, encouraging, and enabling people to be more active. So I wish you a very successful day at your conference, and I will be looking forward to hearing the outcomes of your meeting, and I wish you all the success. Thank you very much for the opportunity to provide these introductory remarks, and all the very best.